Welcome to the Arc Sciences Sterisol Injection Technique training video. More information can be found online by visiting arcsciences.com. The materials you will need to properly perform the injection procedure are a lab coat, latex surgical gloves, mild soap for washing the scrotal area, chlorhexidine, and gauze for drying the scrotal area. Do not use alcohol, benzyl, or iodine, as these may irritate the scrotal area. You will also need 3 sterile needles, preferably 28 gauge, and 2 insulin syringes. The proper amount of Sterisol to administer is based on testicular width, but that the maximum permissible dose for any patient is 1 milliliter per testes. It is recommended to give the patient a light sedative prior to performing the injection procedure. An anti-inflammatory should also be administered to achieve a level of comfort in the patient. A general physical examination should be done prior to the injection. You will need a stethoscope, thermometer, pen light for diagnosis, and a calculator to calculate the correct amount for the sedative. As with any medical procedure, it is important that the patient be healthy. Pay close attention to the scrotal area and confirm there are no abrasions, swelling, or other issues with the scrotal area at the time of injection to avoid any undesirable reactions. To calculate the dose of Sterisol, use the caliper provided. With the patient lying on its back, place the testicles between the 2 measuring points on the caliper and gently slide the caliper at the widest part of the testicle until the caliper touches both sides of the testicle. You will see the caliper contains 2 scales. One indicates testicular width in millimeters. The second indicates the quantity of Sterisol in milliliters to be applied to the testes. Again, the maximum amount permissible to inject into a testes is 1 milliliter. If the arrow indicates the correct dose of application is between 2 scales of measurement, it is recommended to use the higher dose. Proper handling is important when measuring the testicles. Place your fingers on the base of the testicle and move them to the cranial portion. This will allow you to correctly measure the testicle and calculate the proper dose. Each testicle must be measured, as testicles for the same animal may vary in size, requiring different doses for each testicle. To withdraw the product, it is strongly recommended to carefully follow all the instructions. Traditional injection techniques can create undesirable side effects on the testes. The needle should never be placed in your mouth. Remove the cover of the vial, insert the needle to charge the syringe, and do not apply air. Simply withdraw the proper dose previously calculated into the syringe. We recommend purging the potential air bubbles with the syringe still in the bottle. This can be done by tapping the syringe to displace the air from the syringe into the bottle. Verify that the dose is correct and detach the syringe from the needle, placing a new sterile needle on the syringe in preparation for administering Sterisol into the first testicle. Repeat this procedure using the second syringe for administering Sterisol into the second testicle. Remember to detach the needle from the syringe while the bottle is inverted. Otherwise, there is a possibility that some of the product could discharge, and the loss of product could result in inadequate dosage. It is important to remember, once the syringe has been charged, avoid handling the plunger to eliminate any Sterisol being discharged onto the scrotal area accidentally. If the product does come in contact with the skin, irritation may occur. As stated previously, you should wash the scrotal area prior to the injection of Sterisol. But unlike surgical castration, there is no need to shave or perform depilatory procedures on the area. This may irritate the scrotal skin and increase the possibility of the patient licking or biting the irritated area. Wash the area completely using a mild antiseptic soap and fully dry the area using the gauze, removing all foreign debris around the scrotal area. To apply the product, it is recommended to hold the syringe like a dart. If you are a right-handed person, as shown in the video, we suggest putting your hand on the abdomen of the patient for support and to have better control of the syringe at the moment of inserting the needle into the injection site. Hold the testicle firmly but gently, moving toward the gland near the cranial portion, creating a clear view of the caput epididymis. The skin of the scrotum joins the testicular parenchyma, so that once the injection procedure is complete and you withdraw the syringe and release the testicle, the skin will return to its original position, achieving a natural seal. When measuring the testicle to calculate the dose, you can estimate the length of needle to use. We suggest a 1/2 inch or 1 inch needle to deliver the product into the center of the testicle. Once you have the testicle between your index and thumb fingers, and locate the cranial position where the scrotal skin is perfectly adhered to the parenchyma, locate the edge of the caput epididymis. The needle must be inserted above the caput epididymis, skull dorsal cranial portion of the testes. Insert the needle pointing towards the center of the testicular parenchyma, parallel to the longitudinal axis of the testicle. Once the needle is in place in the correct site, do not move the needle. We must remember that the needle is sharp and major lesions may occur if the needle is jostled inside the testes. Unlike a traditional injection procedure, do not aspirate before applying the product. The speed of injection is very important. We suggest taking at least 5 seconds to inject Sterisol into each testicle. If you inject Sterisol too quickly, the testicular nerves will cause a contraction of the seminiferous tubules, forcing the product out of the testes and into the scrotal sac, causing discomfort to the patient and increasing the likelihood of a possible ulcer to form. Once the injection is complete, please take a second and then remove the needle from the testicle, immediately releasing the testicle to achieve a natural seal. If any Sterisol appears on the scrotum, immediately wash with ample quantities of antiseptic solution and water, and then dry the area without excessive manipulation of the testes. After injection process is complete, it is recommended to use an anti-inflammatory or analgesic drug. The type of medicine is left to the discretion of the veterinarian. Recent studies have shown that the majority of patients have expressed no discomfort during or after the injection. But for the purpose of maintaining the welfare of the patient, the application of an anti-inflammatory drug is recommended in accordance with the directions of the manufacturer to achieve the desired level of comfort for the patient. A light chemical restraint achieves a faster patient recovery. As you can see in the video, the patient has just returned from sedation. The entire injection process should not take more than 10 minutes, which is beneficial to the patient as well as the pet owner. The patient may return home with the pet owner soon after the procedure is completed. You can see the patient shows no discomfort after the injection, even allowing the veterinarian to palpate the testicles without pain. It is important to see the patient can sit normally without any discomfort. The application of Sterisol is an effective alternative to surgical castration and in most cases is a painless procedure. For more information, please visit our website at arcsciences.com to access our post-injection care procedures and recommendations, as well as the Sterisol Veterinary Instruction Manual. Thank you for your interest in Sterisol.